Welcome back to ABC 7 at 4, everyone. I'm Mark Ross. Well, June is National Oral Health Awareness Month, and our medical contributor, Dr. Ogechika Alozie with Sunset West Health, is here with some things you need to know about your oral health. Doctor, I was not aware that gum disease was such a prevalent problem in this country.
We never think about it because when you talk about going to the doctor, that's not what we talk about. We talk about going to check out your heart and your kidney and your liver. But it's remarkable that almost half of America, 42.7%, has some sort of oral dysfunction, what's called periodontitis. And that's 65 million people. The frustrating thing is it's aligned with socioeconomic status. We live on the borderland, and you can see at the bottom that it seems to be more in households of Hispanic origin. And all of these things lead to downside effects that we're going to talk about really quickly.
And gum disease can actually lead to more serious health issues, right?
Absolutely. So what people don't realize that when you have cavities and perioral disease, you can actually have an increased risk of heart disease. It's not just heart disease, there's some other things. And obviously it leads to tooth loss, and nobody wants to walk around without teeth.
No. Who's more likely to develop gum disease?
You know, it's interesting. And again, it's that running thread. If you have to break down all the things we talk about in the course of a year, it's don't smoke, right? You can't fix your poverty level and potentially your education level. Those are high risk. And then women who are pregnant also have a higher risk because of a lot of inflammation that goes on.
Okay, and let's go over the 9 ways to care for your oral health.
I think the biggest thing for me is just like going to your doctor's office, you have to go to your dentist. You should go at least twice a year. We don't talk about it, and it's number 3, but drinking the right kind of water, fluorinated water. We drink a lot of this bottled water. One of the downsides of some of the bottled water is it's not fluorinated, right? And the other thing, and I missed number 1, which is critically important, brush your teeth. If you don't brush your teeth, you can't get those stains and the plaque and everything else off of it. So that's critically important.
Okay, I think we're missing one graphic. Can we go to the next graphic, guys? Because I think we're skipping one here.
And I can talk through it, right? So you think about brushing your teeth, you think about going to the dentist, you think about making sure that you're health aware, and then things like flossing and making sure that you're not eating sugary foods and controlling your diabetes and smoking that we just talked about. All of these things go into taking care of your teeth. I think sort of the other thing about it too is that when we talk about tooth health, it's not just that. You may have a plaque, you may have discoloration of your tongue, you may have a growth on the cheeks. Whenever you have things that are strange, I think it's really important to go talk to your dentist about it, right? That person can help you get the right care that you need. And there's a host of resources for it as well.
Cheek cancer, tongue cancer, all kinds of mouth cancers.
Yeah, absolutely. All things we don't think about. You're going to have bright teeth.
But you need to think about it now, folks.
Absolutely.
Dr. Ogechika Alozie, as always, thank you so much.